X-Cube i9 Manual Guide. Monitor layout. The monitor is dependent on the mode you are actively viewing. 1. Left column displays the various scanning technologies available in 2D, like inversion, harmonics, dual live as a few choices. This area changes with each scan mode activation. 2. Across the top of the monitor is the clinic or hospital name, patient information, and date, time. The display of this information is customizable in System Setup. 3. The central monitor area is the image area, imaging parameters, gray color bar, and focal number and position. 4. Right column is the image clipboard where the saved images and cines are in view. 5. Across the lower monitor is the soft menu and trackball controls and status. Monitor display for customized user, print keys, and system icons. At the bottom left of the display lies the 4 user buttons. They will only appear after they are assigned a function. To assign a function, enter the system's preset. User setting. User-defined key. Press the desired function and assign to the key. At the left bottom of the display lies the 2 print keys and the system status bar.